guys, we are back, and right now for Health Watch, we are going to speak to one of our very own, Dr. Naomi Merville, who is on the front line. Dr. Merville, how are you? And for those who do not know, I mean, she is a phenomenal woman who is in the community. She has been a nurse practitioner for over 20 years. She is a community leader and an entrepreneur, not to mention a phenomenal mother to two beautiful girls. Dr. Merville, what else would you like to share?
Now, according to World Health Organization and the Center for Disease Control and Prevention, there are many types of human coronavirus. Mm-hmm. So the COVID-19 is the one that actually caused the severe acute respiratory syndrome, coronavirus 2, that is actually making us scared in the community, or should I say worldwide. It is actually a respiratory disease, meaning that someone can get it through inhalation. It could be through droplet. Now, what I want you to understand is that the coronavirus has different strains, just like I said, and the COVID-19 is what we're dealing with right now. Now, remember, every year we have the flu season, and every year it's a different strain. That's the reason why every year we have different type of vaccines for those particular flu. So the coronavirus happened to be a vicious virus, I should say. Now, in regards to the coronavirus, like I was saying, someone can get it through droplet, according to CDC and WHO.
And what is droplet?
Droplets can be in different format or shape. Now, if someone sneezes, let's say that you are close to me. Mm-hmm. I happen to have the virus. I sneeze, and you are in close
proximity.
You are very close to me. Most likely, you inhale the droplet. You will definitely be infected. Now, if I happen to sneeze by using my hand, and I go and touch any type of surfaces, that could be a table, that could be the mouse of the computer, that could be a doorknob, and someone comes behind me and touch that particular doorknob or that particular table for some reason, and they happen to touch their face, they would definitely be exposed to the COVID-19. Although when you touch your face, you are touching your skin, although that according to World Health Organization and the Center for Disease Control, the COVID-19 is not absorbed to the skin. However, when you touch your face, you breathe to your nose and your mouth. So when you touch your face, you actually deposit the virus near your nose and your mouth. So that's how the particular virus will get into your respiratory system, will get into your lungs, and cause a different type of problems.
So one of the things that we are facing right now is, how to not get infected, right? So everybody is on the focus on, I do not want to get infected, and I need to stay at home. I need to practice social distancing. So we have all this new vocabulary now. And I need to ensure that there is a 6 feet distance between someone and I at any point in time, because I don't know if they're infected. And because I don't know, I need to act as if everyone is infected so that I do not get infected. What are some of the things that you can tell us that we can do to self-check ourselves, whether it be daily, whether it be every 2 days or every 3 days? Probably based on what's going on, I would say daily. What are some of the things that we can do on our own to ensure that throughout the day or based on the day prior, we did not catch this virus?
Well, Naomi, in order for anyone to know how to check herself or himself, it is vital to understand some of the symptoms, because if you do not know symptoms, there is no way that you will do preventative measures. And knowing the symptoms of COVID-19 is very vital. So let's say you are exposed to COVID-19. Again, according to World Health Organization and the Center for Disease Control and Prevention, if you are exposed to COVID-19, most likely you may present with symptoms 2 to 14 days after the exposure. So some of the symptoms include a low-grade fever. Some patients have reported high-grade fever as well. Now remember, every case is different, but the norm is fever, a dry cough, as well as shortness of breath. Now, some of the symptoms can be mild to severe. And the severe part, that's when, the patient is having severe shortness of breath, they really cannot breathe. And that's what we call the acute respiratory distress, meaning that most likely that particular patient will be intubated. Intubated meaning that that particular patient will be put into the ventilator machine. The machine has to breathe for that particular patient. So what is very important is to understand the early signs. The early signs: fever, cough, / shortness of breath. And you must call your primary care physician, and especially if you know that you were exposed, because not everybody know that they are exposed, because someone may have it and not show any sign and symptoms, but yet they are contaminating other people. So knowing the early sign and symptoms is vital. If you are presenting with the symptoms and you know for a fact that you were exposed, you have to call your healthcare provider. And your healthcare provider will actually guide you on what to do, such as they'll probably tell you to take Tylenol, to control the fever, meaning that monitoring the fever, I should say. And if they have the test themselves in the clinic, which some clinics, they do have it, some primary care physicians, they do have it. Not all. I know my primary does. They will test you. And they may also refer you to a facility where you can get tested.
Okay.
I know that they have different sites. Some site you have to call to place an appointment. And some site, if you happen to be a healthcare provider or if you happen to be a first responder, you may not necessarily need to have an appointment to be tested. Now, again, we were talking about to check ourselves. Now we have to make sure we wash our hands, because
first and foremost.
Exactly, Naomi. If you do not wash your hand, there is no way that